Welcome to the Chad G. Ortho OT Podcast. I'm your host, Chad Guerrero. I'm an orthopedic occupational therapist, strength and conditioning coach, sports trainer, and I hold over 40 specialty certifications in manual therapy, orthopedics, and sports medicine. On this podcast, we will discuss everything orthopedic therapy, sports medicine, and more. If you're a therapist, health and fitness professional, or someone just wanting to learn more about the orthopedic and sports medicine world, then this is a podcast for you. Let's get started. Hey everyone, thanks for listening to another episode of the Chad G. Ortho OT Podcast. Of course, I'm your host, Chad G. And today we're going to talk about lateral epicondylitis or epicondylalgia. You know, a lot of people know this as tennis elbow, where you have that pain on the outside of the elbow that's just annoying and just doesn't want to go away. So I'm going to kind of go through a little bit of why that happens, and then, kind of how to check for it at home. And then lastly, what are the treatments for that? Like, how can you get rid of it? Because for a lot of people, and I've suffered with it myself, it's just so aggravating. It just doesn't get better. A lot of times it seems like on your own, or at least it doesn't get better fast enough, and it just can really be debilitating depending on what your occupations are, what your job is, what your leisure activities are, stuff like that. So it's called lateral epicondylitis, or inflammation on the outside portion of the elbow on an area known as the lateral epicondyle, kind of that bony portion on the outside of the elbow. And it affects, between 1% and 3% of adults throughout their lifetime each year. And, which doesn't seem like a lot, but if you think about how many people there are in the world, it's a pretty high incidence or high occurrence of this happening. And so, you notice that you have this pain on the outside of the elbow. It may throb and ache. It may burn. You may have pain that goes down into the hand, on the back of the hand, and not in the palm. That's going to be something different. On the back of the hand, it may radiate up to the shoulder. Some people say they feel like their elbow needs to pop and it would feel better. Or if they hold like compression on it and the squeeze, that's going to feel better. Again, it presents differently. It's not always pain, for people. So most commonly it's pain, but, it can kind of present differently for different people. A lot of times when I get people in, the clinic, or I see them out in town and they ask me, they're like, I got this pain outside my elbow, and I'm dropping items, when I, at home, stuff's falling out of my hands, having trouble gripping and squeezing. So a lot of times they say, I know what to do. Maybe I went to see my family doctor or something like that. And, they give me some anti-inflammatories, or give me a steroid shot, or, told me to wear this brace. And of course, those aren't wrong, or even icing, things like that. Those aren't wrong. But in some cases, especially depending on if you've not had this really evaluated by somebody who's looking at the mechanics of what's your movement look like, what are the things that you're doing. Because, a lot of times you go to the doctor's office, they don't really have a lot of time to spend with you to go over all those detailed things. They're good at giving a diagnosis, or a basic diagnosis, and they're referring you off to somebody who does this, for a living, and then kind of go from there. So, like I said, they'll have this pain that come in, they're maybe dropping items, the back of their fingers are tingling or something like that. And so a really quick assessment for that, which is so simple, that you can do, at home, is basically you passively pull your hand down into like a flexed position. So you're bringing your fingers, if you kind of keep your fingers flat, you're bringing your fingers towards your forearm, and you bend the wrist forwards. And if that, with your other hand, you can take your other hand and do that. And if that increases your pain or reproduces your symptoms on your elbow, of course, that test is positive. And then if you take your hand and you try to pull it back the opposite way, like if you were going to do a handstand or something like that, and you pull your wrist back the opposite way so that your fingers and the back of your hand come towards, the back side of your forearm, and you just resist it. Use your other hand and resist this movement. And if that also reproduces the pain there, well, then we very likely have a positive lateral epicondylitis or epicondylalgia going on. And the reason, for this happening, there's some criteria that kind of puts you at risk for developing this. One of those is being over the age of 40, smoking, obesity, or doing any repetitive movements with that extremity for greater than 2 hours a day. There's been some research that supports anything greater than 2 hours a day. Any vigorous loads that you're picking up, especially one-handed if you're picking things up, and that also increases your risk of developing the issue. And it's most commonly the ECRB tendon is involved, which stands for extensor carpi radialis brevis. And the reason that it's most commonly involved is because it has a really small attachment point. Every muscle has an origin and an insertion, although that's been debatable as to what side's the origin, what side's the insertion, are they both origins, et cetera, et cetera. But it originates from that lateral epicondyle area, that bony area on the elbow, and its tendon is really small there, right? So there's not a lot of space. Well, the force is kind of is distributed out, rather, and so it pulls on the bone right there, and it's going to inflame it. So it doesn't take a lot of force. And it's similar if, somebody comes up behind you, or, they poke you, right, with something kind of pointy, and they poke you. That's more uncomfortable than somebody coming up, say, and taking the whole palm of their hand and touching you with the same amount of force on your back or whatever. It's more comfortable because that force is distributed out more. So that is the most common muscle and tendon that's involved. Also, the extensor digitorum communis is also involved. Now, you don't have to remember that, but the location is a little further down on the forearm, a little closer to the hand when that one's involved. But again, the treatment for both of those is really the same. Conservative treatment usually does very well. In like, I think it's like 80 to 90% of these people that are suffering with this, within 1 to 2 years, it's going to resolve. Now, just spontaneously, if you don't do anything. The only question that I had with that when I read that in the research was, well, most people don't want to wait 2 years for the elbow pain to resolve. And it's just humans in general. We're just kind of creatures of not a lot of patience, I don't think. So I don't really want to wait 2 years for this resolves itself. I want to get back to doing all the things I want to do right now and not wait. But then when, if you're going to have treatment with this, and the other part of that was going to be, if you continue to do the same thing. So let's say that I'm going to wait my 2 years because I developed it. So I'm just going to wait my 2 years, right? So, here I am waiting, or 1 to 2 years. And if I continue to do the same thing, it's the causative factor, or the mechanism that causes us to start off with. Well, how is it ever going to get better? I didn't change anything. I mean, why would it get better? So I think, I don't really know on that particular research study. And there's other research that corroborates that says, that's pretty accurate, the time frame. But I just had a question as far as, number one, who's going to wait that long? And number two, what if you're still doing the same thing? Is it not just going to keep it stirred up? So I probably would not go on the side of like, I'm going to wait this thing out, because even though theoretically, statistically, it's going to get better, I just wouldn't wait. That's just me. And so we're going in with treatment. What's the best treatment? What should you do? There's all these different theories of things. There's been a lot of research over the years. In fact, a tremendous amount of research on this particular issue. And usually, of course, I'm a fan of therapy because I'm a therapist, right? But usually the therapy will make a significant difference and will resolve this at a much faster rate. We're doing progressive exercises, specific things that you need to be doing to progressively load these tendons to improve the healing process, and then, of course, build strength. The other is some manual therapy. That's hands-on technique, whether it's massage or soft tissue scraping or cupping or trigger point therapy or joint mobilization, stride needling, whatever, can have an improvement. There is research that supports joint mobilization, where the therapist gently takes the radius bone on that side and that outside and do some mobilization there that can have an improvement with that. Also, mobilization with movement, which I also practice, does very well with that, as well as resolving pain and improving range of motion. And then, of course, you've got things like modalities with ultrasound and lasering and all those other things. Not as much research to support that some of that really works all that great. I mean, when I started as a therapist, everybody got ultrasound on that because that was the cure-all for, a lot of things. And, of course, you found out, probably not as great as we all thought it was at the time. But I don't know of it necessarily hurting anything, as long as, the person's a candidate to be ultrasound in that area to just try to improve the blood flow and all that. But a lot of times, just to save time, I would, put a moist hot pack or something on while I was using electric stim or use a laser or something like that instead. I don't use the ultrasound as much for that as I used to, but still do it in some cases. If the patient says, "Hey, this helped me. I feel like this was beneficial," then of course I'm going to do it as long as it's safe and they're a candidate for it. So the other things are things like braces, just sleeping in, things like that at nighttime splints and things that works really well. And again, you got to look at if you're going to wear a brace during the day or some sort of supportive splint or this during the day. You can create some other issues, modified movement patterns and compensation that can go on if you can't move the elbow correctly or the wrist correctly. So I think, you're fixing one thing kind of may make something else mess up if you're not careful. So you really want to have that looked at. Don't just, try to go get whatever's the next thing at the drugstore or the, dollar store, wherever you're going. You would just, like I said, you want to have that evaluated by somebody who's had experience with that, what's going to be good for you, what's not. Because a lot of times people get those little bands, that kind of band that you put around the forearm. And, those things can cause other issues. I've seen people give themselves like a radial tunnel syndrome or, irritate the radial nerve that comes down the outside because the concept of those bands is it puts pressure over the tendon, the muscle. We're really more muscle area in that because the tendon is very small. We're putting pressure over that. And so you're creating like this false attachment point. So if we're like doing tug of war, right, and I've got, I'm pulling and I'm getting tired because I'm inflamed and I'm irritated, if someone gets in front of me and they pull, I'm having to pull less. So that's kind of how those little bands work, is it's creating this false attachment point to give the tissue behind the band a little bit of a break, which is not bad, but you got to be careful because people put them so tight and they give themselves just radial nerve injuries and issues with that. So I've had people that come in and then with both of these things. It's like, oh my gosh, you've got a couple things going on. Something that I've also had good success with, there's some research that says it's great. Some research says it's inconclusive, using kinesiology tape. I like to use the tape in this area, not so much for like some kind of mechanical correction or anything like that, but just try to desensitize the area. If familiar with some of the work of like the pain science guys, that's really been a big, kind of a buzz in the last few years, trying to desensitize the area so that it's not so like hyper vigilant and hyper irritable. So I like to use a kinesiology tape. And I think that helps. And a lot of patients say they feel like that helps too, So again, it's one of those things like if you think that it helps, and even maybe if there's not this tremendous research that says absolutely this helps, then I don't see any issue with it. If it helps you to move better and move in and be able to carry over at a higher functional level, why not do it? If it's not going to hurt you, just go ahead and see what you get. So, in worst case scenarios, you have to have this operated on. The surgeon goes in and cleans up the area. I actually had a patient a while back that had to have this cleaned up because of the scarring and all, that had really some calcifications that started to form in the ECRB tendon. And it was really interesting because when the patient come in, he's a softball player and for high school, and comes in and there's a limitation. So the orthopedic didn't refer to therapy, just cleaned it all up and kind of sent her on her way. And the reason she came to therapy was because she didn't have full extension. And she was lacking probably 30 to 40 degrees of full elbow extension, being able to straighten out the elbow. And at the end of flexion, kind of making a bicep, there's a little bit of limitation there, but wasn't nearly as bad as the extension. And I've been trying to stretch it at home, do stuff at home, just really was not getting the results. And so the doctor sent her to therapy. And so in evaluation, I evaluated it and checked it all out. And I said, what we're going to do? We're going to try this technique called, mobilization with movement. And I used one of the mobilization belts. It's supposed to be a completely painless process. I know for some people, and I've read some stuff that said they have a little bit of pain, but the way that I learned it, Brian Mulligan's teachings was, it should be pain-free. And so I did the technique, and actually the patient's mom was in the room, and completely painless. I put the belt on around the forearm, pulled on it, brought her elbow out into full extension, and we had full extension all but the last 5 degrees. So just very minimal at the end that I didn't get. And I could have got it, I just didn't really push it. So that works fantastic. And I mean, it was no pain, and it felt better instantly. And then I had her carry over at home how to continue doing that with this overpressure technique, which is very part of the program. And she kept the range of motion. By the second visit, we had full range of motion back, which was great. It's kind of mind-blowing too, especially for the patient, because she was like, oh my gosh, I can't believe we just got all of that. And that didn't even hurt. I've been trying to stretch it at home, and I couldn't get it. And so anyway, so that's in worst case scenarios. You have the surgery. That for me would be a last case or a last option. And really, I should have said this. The thing before that's on my list of treatments would have been a direct injection, a steroid injection, or something into that tendinous area. You have to be careful because those steroid injections directly into a tendon can temporarily weaken the tendon. So if you're not familiar with that, or you're not aware of that, and the doctor, somebody doesn't tell you that, you feel better already, right? Like you go home and say, this is already better. And then you go to lift on something, push or pull or whatever, bam, we avulse a tendon off the bone or cause an avulsion fracture in the bone. So that's just something to be aware of. So if you get injections directly into that, always ask your doctor, is there anything specific that I need to do or not do? So if we're looking again, overall treatment, my recommendations are this. Obviously, number one is going to be therapy and conservative measures, icing at home or heat or whatever feels best to you with that. But therapy measures, and then I would go down to an injection, and then I would go down to surgery. I just don't think that not doing anything about it would be even on my radar, just because the longer this stays inflamed, the more likely you are to develop like calcifications, and then that can lead to surgery. And so you waited 1.5 years or 2 years or whatever, and you ended up having to have surgery anyway. So I just don't think that's worth it. I would go ahead and have something done about it, and just going about my life. So anyway, I hope this has helped, guys. And with lateral epicondylitis or epicondylalgia, tennis elbow. Ironically, by the way, more tennis players statistically end up with pain on the inside of the elbow, so golfer's elbow. And I thought that was very interesting. Or medial epicondylitis than they do tennis elbow. And more golfers end up with tennis elbow than golfer's elbow, apparently. Now, I don't really know. I read a couple of research studies that supported that. And then I certified with a golf injury prevention certification program that talked about that. So that's supposed that's that way. But either way, if you have pain on the inside or the outside of the elbow, you definitely want to have that looked at. You definitely want to see what's going on, make sure that is what it is, and then what are the steps to try to take care of it. So thanks so much for listening, guys. Please rate me 5 stars wherever you listen. Again, that helps me out. Thanks again so much, and have a great day. This podcast is brought to you by Guerrero Rehabilitation, setting the bar for rehabilitative and sports medicine care.